Welcome to the Face to Face. I'm your host, Genevieve Kyle-Lefebvre. Face to Face is a bilingual series of video recorded here in Coquitlam. We acknowledge that Coquitlam is located on the ancestral, traditional, and unceded territory of the Coquitlam First Nation, who continue to care for these lands, waters, and all living things. Today I am with Kristina Chung, Executive Director of the Ridge Hospital Foundation. Welcome.
Hello. Thank you, Genevieve. Thank you for having me. It's a pleasure to be here. And
yes,
I'm
so
happy to chatting.
Absolutely, absolutely. First of all, we want to know, what is the Ridge Foundation Hospital Foundation?
So, Ridge Hospital Foundation is a nonprofit organization. It's a registered nonprofit, and we support the equipment and program needs of not only Ridge Hospital, which is located in Port Moody, but also the community health programs that are located throughout the Tri-Cities region. So we serve the healthcare needs of Port Moody, Coquitlam, Port Coquitlam, Anmore, and Balcarra residents, as well as anyone else who walks through our door. We support all the needs at the hospital, so capital equipment, expansion, redevelopment projects, program needs for special programs directed at patient care. And we have been a nonprofit organization supporting the community since 1982.
Wow, okay. So what are some of the foundation's biggest achievements in the recent years?
In the most recent years, we achieved our highest campaign goal ever, which was a $5 million contribution to the expansion and redevelopment at Ridge Hospital of the emergency, cardiology, and community outpatient services departments. Following on the heels of that $5 million campaign, we completed and reached the goal for a $2.1 million campaign to support the medical imaging project that supports all the needs on site at the hospital as well.
Wow, that's amazing. And how does the foundation decide which project and service to support? There's so much when we think about like hospitals. Where do you start? How do you start?
Yes, there is so much, not only just in the hospitals, but throughout the community. There are various programs that we support. And we take our direction from Fraser Health. So the ministry and Fraser Health decide what are the highest priorities for our site, for our community, based on the growing demand, not only on healthcare needs, but the population growth in our communities.
Okay, I see. And is there also some individuals that get help, like patients, staff? How does that work?
So we support many different initiatives. So we do support staff through education and professional development, supporting nurses going to conferences that will enhance the services they provide. We support individuals who are discharged from hospital through the social workers program. So sometimes patients that are discharged require support at home. Sometimes their home may need modification, or they even need transportation, things like that. That is in addition to the equipment and program needs.
I can see. And how, if someone is in need, so do they just reach out to you? How does that work?
It depends on what it is for. So if it's through the social worker program, so the social workers would be in touch with us. If it's for equipment or program needs for a department, that would come through the staff of the hospital, the administrative staff. If it comes from our community health programs, like I mentioned, we support various healthcare programs in the community, some of which run through different organizations or institutions, should I say. We support adult mental health program, which runs out of the lodges at Riverview Lands. And that is like your typical healthcare need. The residents there need support with their long-term coping skills to deal with their mental health illnesses. Whereas our programs such as our Hearing for Kids, which is a Fraser Health-wide initiative, children are often referred to audiologists through their teachers, their schools. And then the audiologists, under having reviewed them and put them through tests, then they recommend they need hearing aids. And if the family qualifies based on their economic level, then they would qualify to have us fund hearing aids for their children.
Okay, so there's many layers, many organizations you work with.
Yes.
So I'm hearing a little bit of it's Fraser Health, there's other ones. So can you talk to us about which other ones you work with?
Basically, it's all under the Fraser Health umbrella. So whether it's public health to do with the audiology, whether it is the Tri-Cities dialysis unit, that is again a Fraser Health program that's located in the community of Coquitlam, so outside of the hospital, whether it's to do with the schools for our youth mental health programs, we support those as well. Essentially, there's always a connection through Fraser Health because we do work in conjunction with Fraser Health and the needs of the services they provide.
Yeah, I can see. So what is the main impact or impacts, if there's more than one, of the Eagle Ridge Hospital Foundation on the Tri-Cities?
We serve everyone that comes to the door at Eagle Ridge Hospital. So Eagle Ridge Hospital is classified as a community hospital versus a regional trauma center. So although we don't necessarily have the high level of classification, just say, you see other large hospitals have provincial impact or regional impact, we're considered a community hospital. But that being said, we also treat anyone and everyone who walks through that door. So we, even though we don't have a maternity department, just say, but if there have babies that have been born at Eagle Ridge, we don't necessarily have a large complement of geriatric staff, but of course, if we have a geriatric patient come in, they're certainly treated. We do now, through the expansion of our emergency department, we do have new resuscitation trauma spaces. So although we aren't classified as a trauma hospital, we can treat a patient just as well as another site that is deemed a trauma hospital does.
And how can you measure the impact on the Tri-Cities? I know we touched on what's the impact and how do you measure it?
So we, of course, Fraser Health produces stats from all the visits and patient feedback from their sites, and they share that with us. And for us, we tell the story of the impact that our donors make on the hospital, the healthcare in our community. And so us being able to demonstrate the impact that their support makes to the patients that do walk through our doors, makes us successful because we are able to show that we tell the story of the need and our donors respond to that.
That's very good. That's very good. And if someone wants to get involved, what can they do?
They can certainly reach out to us. Our website is erhf.ca. Of course, you Google us, Eagle Ridge Hospital Foundation. Our office is located in the hospital, right near the main entrance, which is really great because our donors, they come into the hospital to be treated. They come in for appointments. So they come in and see us and they visit us. And essentially keeping your eye out on our social media. We are involved in a lot of events in the community that we host. We host some signature events. We are often recipients of organizations or businesses holding events or fundraising initiatives. So certainly just keeping your eye out and, like I said, searching for us.
Yes,
you'll
absolutely.
find us.
Earlier, you touched on some people get to really have great experience throughout the hospital foundation. Can you give us an example of people that probably the organization changed their life?
Yes. So I mentioned the Hearing for Kids program, and we do hear great feedback. We're often sent photos and little notes from children who have received hearing aids or their families, and it is so heartwarming. Another important program that we fund is the Areola Tattoo Clinic. This clinic runs out of Eagle Ridge Hospital, but it is a program that is open to everyone in the province, essentially, and it is one of the only ones available in the province. It is a completely donor-funded program. It is completely funded by Eagle Ridge Hospital Foundation. And this service provides areola tattooing for women that have gone through the breast cancer journey following their reconstructive surgery. And it is the last and final step to their recovery and back on the road of recovery after their journey.
That's amazing. And so what I'm hearing, so people from all over the mainland are coming here to get the tattoos if they decide to, if they want it, I guess, too, right?
Absolutely, absolutely. And like I said, it's completely donor funded. So often it's a hindrance to have a cost like that after so much that a patient has gone through emotionally, physically, psychologically, and the financial burden of dealing with a health situation like that. So having this such important service available and being free of charge is really impactful. We hear from patients all the time how it's life-changing, and again, how it's that final piece and they've been able to pick up and carry on back where they were, if not stronger, following the procedure.
So who had that idea to do this?
We have an RN at our site, and her name is Sandy Saunier, and she provides the service. And this predated my time with the foundation, but through working with one of the plastic surgeons who does the reconstructive surgery, I believe Sandy discovered this service elsewhere and felt it was important to bring it to our community. And I wouldn't even be able to tell you how long she's been doing it, but she's been doing it a long time. She's fantastic. She's a wonderful human. And I think it provides her as much joy as it does for the patients. And she's absolutely wonderful. And I love the fact that she saw this idea and heard of it and felt that it was so important and brought it to our site. And it's been going strong.
Of course, when we think about breast cancer, we think about mostly women, but there's some men that also go through breast cancer. Are you welcoming also men to the Areola Tattoo Clinic?
That would be something for Sandy to decide.
Okay.
In my time and my experience with the program is I don't believe she's had any male patients. And that may be because most of the referrals come through physicians that are mostly dealing with women's health issues.
Okay, I see, but it could be a possibility.
It could be, yes.
Yeah, I can see. That's amazing. And is the clinic, is the organization also supports like breast cancer survivors through their recovery journey? How's that work?
What we do is we are a resource. So when anyone goes through the journey and they're looking for more information, we are certainly equipped to provide resources or avenues for them to seek out their resources. We specifically don't have sort of a post surgery or post-procedure program in place, but certainly we have the resources because our close connections with the healthcare staff and the Fraser Health community as a whole, and they do provide a lot of services like that.
That's amazing. Any events happening this year in 2025? Talk to us about what's happening, and if people want to go, let's find out what you guys are up to.
Yes, absolutely. We have 2 signature events. Okay. So events that we hold annually, and we've held them for a very long time. I know the Evening of Caring Gala has been around since the beginning of the foundation. In fact, it probably predated the foundation. Oh, wow. And that is taking place on Saturday, September the 13th, downtown at the Fairmont Pacific Rim. And we're excited because this year's theme is a vintage Vegas theme.
Oh, wow.
And the venue is beautiful, and the food promises to be amazing, and it'll be a great night, as well as our annual Charity Golf Classic. And that takes place on Wednesday, July 9th. And it will be at the Green Tea Golf Course up at the former Westwood Plateau Golf and Country Club.
Perfect.
Yes,
excellent.
Yes. And both of those events, they are on our website, so information is available there. We have also started in the past year of getting out in the community more, doing events that would speak to more people than just gala or golf do. So we have coming up on May the 25th, we're doing an event at a local brewery in Port Coquitlam. And we have some live music.
Where is that?
That's at Patina Brewery.
Patina Brewery.
In Port Coquitlam. And we have live music, we have brews, we have food. It's a great event. This will be our second one that we're hosting. The first one was met with great response. And so we're really excited for this one.
That's great. Doing new things and evolving. And people like to go sit down together, create a social, give You know,
Absolutely.
I'm sure there's a giving part to it, and also get to know your community.
Yes, absolutely. It's a great chance for people to come together in a casual way or in a formal way at gala.
Yes.
And, we at these events, we always have silent auctions and sometimes live auctions, and we have 50/50s and we have raffles, and it's a lot of fun.
Yeah.
It's really a lot of fun.
If people want to contribute to those silent auction, they just message you, contact you, and get in contact. And that's another way of giving, I guess, right?
Absolutely. We have a lot of local businesses and organizations that we are so fortunate to be partners with, and they provide us with some amazing gifts, amazing prizes to be won through our silent auction, and even in our live auction as well. We have some very, very generous donors who contribute those, and contributing items like that provides exposure. We have a great platform for our silent auction, and we always indicate the donor and logos where we can, and it is a great way, you're right, to support the foundation.
That's amazing. I'm curious, Kristina, why did you decide to work as, now you're an executive director for the Eagle Ridge Hospital Foundation? It's quite a giving work. You have to have the heart at the right place. So why did you choose this?
Funny enough, I fell into fundraising just sort of by default when my children were involved in a parent cooperative preschool, and I started being involved with PAC at the elementary school and putting on events and fundraisers, and it just brought me so much joy to see the kids have, breakfast with Santa at school, or to put on an art auction and have all the parents get together and raise some funds for the school. And when my children entered school and didn't need me at home all day, I wanted to get out there and give back. And so I've been fortunate to work for a few different organizations over the years, but have really found my niche and my love in healthcare.
That's amazing.
I do love it.
That's amazing. Well, it's a lot of work, but I feel like you've been in it for a while, so I'm happy to see you happy with it.
Oh, thank you.
Yeah, that's great. What are the hopes for the Eagle Ridge Hospital Foundation? What's the future?
Our hope for the future of Eagle Ridge Hospital Foundation is that not only do we continue to do what we're doing and that we do so well, is to provide for the healthcare needs of our community, but to also advocate for future needs of our community. Our community is growing, our community is aging, it is very diverse in its healthcare needs, and our hope is that we can not only support and provide for what our community needs, but to advocate for those that may not be heard and those that may be forgotten about, and do what we can to make those voices heard and support them in the ways that they need.
Yeah, that's amazing. I'm curious, another question for you. Is there anybody that was helped from the foundation and now are helping back or maybe involved with the organization?
Absolutely. We often have volunteers that come out to support us at our events or go out in the community and look for donations for us, like you mentioned, for the silent auction. And in more cases than not, it's because they've been touched by the care at Eagle Ridge Hospital. Perhaps if it's just say a senior that may be retired, their spouse may have been impacted by the care that they've received and have since passed, so they have time and they want to give back in memory and in honor of their loved one. So certainly we do see that. It's typically people have been touched in a very special way, and they very easily and very readily want to give back.
Yeah, I can see that. And if someone wants to organize something, is there a little smaller get together, or we can contact you if we want to, let's say, raise some money? How's that work?
Absolutely. Like I mentioned, we have organizations, we have individuals that like to plan events that support us. So we have sometimes a local neighborhood that will put up Christmas lights and invite people to come see it by donation. And we're fortunate to be partnered with these generous donors that have been doing this for a few years now.
Yes, I think I've seen this around, right?
Okay,
yes. So great.
Yeah, it's wonderful and it's so beautiful.
Yeah.
As well as we have, we had a local gym that did a special event where their clients could train their trainers for the evening by donation. And it's pretty fun. I go every year and watch. And so they put them through the ringer. And these clients have donated money towards the foundation to be able to do this. We also have had local small businesses that they have a portion of their sales of something specific coming to us at Ridge Hospital Foundation. We've had children do lemonade stands out in the summer. We've had people have a wedding or a birthday party.
Yes.
With, in lieu of gifts, they've had donations made to Ridge Hospital Foundation. So certainly getting in touch with us, we can provide any resource that's required or support for anything like that.
Oh, thank you so much. Thank you so much for coming and talk with Tri-Cities Community Television. I'm hoping people out there that are listening to this video, you get to know a little bit more about the foundation and give your time and maybe come and have a beer soon, right? At the Patina Brewery, and get to know the team. I'm sure, how many people works with you?
We have a team of 6 right now.
Amazing.
So we're all very busy. We have a lot going on, but it's great. It's all for a great cause, and we love what we do. So I appreciate being here, and thank you so much, Genevieve. It's been a pleasure.
Absolutely. And keep doing what you do. It's amazing.
Well, thank you very much. It's my pleasure to be here, and look forward to connecting again.
From Tri-Cities Community Television and myself, Genevieve, thank you so much for watching us today.